This brief video demonstrates how to use unique software created for hospital CFOs that enables a CFO to increase hospital profits by millions of dollars annually in 3 ways. It was developed by a $2 billion hospital profitability company that is owned by a very large private equity firm worth many billions. Dozens of hospitals are now using this software. We are C-Suite Due Diligence, a 25-year-old due diligence community of CPAs, attorneys, software experts, and fractional chief information officers that double business profitability, and we have hundreds of client references. We have helped save clients over $3.5 billion. We vetted software in this space, and we chose this software as the winner. This video will show that the software provides 3 significant competitive advantages that increase profitability. And you'll see how easy it is to use. Because the software is cloud-based and does not require access to your computer network, that means it can be implemented instantly, without any delays caused by either the IT department or the chief information officer having to perform risk analysis or due diligence. The software offers 3 values. 1, we can help make healthcare insurance providers pay you more. 2, we can compare prices, patient outcomes, and 5 other factors for any medical procedure at any hospital nationwide. 3, we can help you hire the best doctors and nurses from anywhere in America. And if you're a for-profit hospital or medical center, we can significantly reduce your business income taxes permanently, which can pay for new doctors or retain existing ones. We have doubled the profits of over 300 businesses in the last 25 years and have never lost an audit, nor have we ever triggered an audit. Number 1, in this software demo video, we will show you how you can compare the commercial contracted rates of your hospital with its competitors based on network and procedural codes in every state of America. There are 7 filters available, including the quality of patient outcomes. To illustrate, imagine your hospital gets paid $20,000 and has a positive patient outcome 92% of the time. A competing hospital gets paid $40,000 and has worse patient outcomes. Having this information strengthens your negotiating leverage with the healthcare provider. Just imagine doing this for all of your procedures, with all of your healthcare providers, for all of your medical centers and hospitals all across America. Number 2, the software lets you compare medical procedure pricing with other hospitals and apply 6 filters, including positive patient outcomes. It helps you set competitive pricing. New transparency laws hold business owners accountable for fiduciary breaches if employees overpay. Fortune 500 companies are now facing class action lawsuits due to overpayments by one single employee. We're going to show you some details on the next slide. Number 3, this software can help hospitals and medical centers recruit the best doctors in America based on productivity, patient outcome rankings, and other factors. We also enable you to offer tax-free income to attract and retain skilled doctors, nurses, and key executives if you are a for-profit hospital or medical center. For 25 years, C-Suite Due Diligence has helped 300-plus businesses reduce income taxes significantly. No one ever lost an audit, as mentioned previously, nor have we ever triggered an audit by this. Our expertise reduces taxes, which fully pays for life insurance policies on key personnel, which provides tax-free income. You decide on the vesting schedule. This service, combined with other solutions, can almost double your annual profits if you're a for-profit hospital or medical center. There are new federal transparency laws that require that businesses shop and compare, and employers now have a fiduciary liability on the co-pays and the deductibles that their employees pay. So number 2 on the previous slide is a very big deal. Johnson & Johnson has 130,000 employees, and because one employee overpaid for their drugs, it resulted in a class action lawsuit. And you're looking at page 43 of the highlighted 74-page class action lawsuit that you can download from our website, csuiteduediligence.com. On average, Johnson & Johnson was paying 498% more than the pharmacy acquisition costs. There are dozens of such lawsuits now against large businesses. When the damages are awarded, this will generate immense publicity, and more lawsuits will be triggered, and it'll be a vicious cycle. That is why number 2 on the previous slide will become so important. So now, let's look at the software in action, achieving value proposition number 1 and number 2. Then we'll have a slide where we'll summarize and we will show value proposition number 3.
Here is a dashboard of a use case in Indiana. We're looking at Anthem and United. They're the two main payers in Indiana. We're looking at what the hospitals themselves posted, and we're looking at a few hospitals within central Indiana: Riverview, IU Health North, Hendricks, and Hancock. And we're looking at DRG 470. That is an inpatient total knee, total hip procedural code. And as you can see, we can quickly look at by provider NPI, by DRG description, by the rate source. We can look at what the Anthem average posted rate is versus United, bumping up against the Medicare adjusted rate. So this is the Medicare adjusted rate that brings in the inpatient prospective payment system adjustment based on zip code to have a really good benchmark of how you're comparing your rates. And you can see the variability across the board here. We can also overlay quality to bring it into the equation. So now you have a bigger picture, not only on what the cost of care is, but what the quality of care is as well, when you're really trying to look at what the value is that you're bringing to the market. So based on this data, hospitals can head into contract negotiations in a position of strength. We can average the top utilized codes, DRG or CPT. We can look at both inpatient and outpatient codes across service lines, comparing to competitors' rates and benchmark to Medicare adjusted rates to focus on negotiations on a percent of Medicare targets. And it enables hospitals to always show up prepared and ready to counter in network negotiations.
Would you like your hospital to outcompete other hospitals so you can hire the best doctors and nurses? The Hospital CFO platform allows hospitals to offer measurable feedback on quality scoring to their existing providers. This information can be used to identify and hire the most qualified talent at other hospitals. We help in 2 ways. First, the software enables you to locate and compare the best before your competition can. How? The CFO platform software works in collaboration with both Quantros and Group Technology to gather claims and group them into major practice categories such as cardiology, orthopedics, hematology, and others. Then you can adjust the data using patient demographics and comorbidities to ensure a fair comparison. You can analyze mortality complications, unplanned encounters, and the number of visits a healthcare provider performs throughout the year. We will show you how you can do this in the software, and you'll see how easy it is to do. The second way we do it is we create significant cost savings that helps pay for hiring the best doctors and nurses. And if you are a for-profit hospital or medical clinic, that includes significantly reducing business income taxes and offering tax-free income to the doctors and nurses and key personnel you want to recruit and retain.
What you see here is that this is a use case in Columbus, Ohio. We're looking at sports medicine within the orthopedics realm, and we're looking at non-surgical. And we have the ability to get down to by provider name within those major practice categories. Like I said, it could be pulmonology, it could be cardiology, etc. But for this scenario, we're looking at sports medicine, and we can look at their overall quality score We can provide information on what goes into that quality scoring, as well as the number of cases that they perform throughout the given year.
Now that we have completed discussing the benefits of this particular software, we just want to draw your attention to the fact that our due diligence community has approved many other cost-saving solutions. There's a government program few know about where you can save $500 per employee on FICA taxes annually. That's an immediate cash flow improvement of $10 per employee per week, and there's no sunset provision. We see this going on for decades, and employees can receive a cash value permanent life insurance policy with a $75,000 death benefit. That has no net cost to employers and no net cost to employees. And this can be implemented anytime throughout the year, and no medical is required, and is completely independent of your health care. The enrollment process is virtual and takes just 10 minutes per employee. You can save up to 20 to 25% on workers' comp, commercial P&C, and health care while maintaining similar coverage. Finally, we want to remind you that the Cures Act affects merchant processing. Most people don't realize that. And the minimum fine is $10,500 per transaction. For instance, if your hospital is doing 1,000 transactions per day, that could lead to a $10 million daily fine. Therefore, we recommend that you use software that we found, which very effectively combines the best database interoperability software with merchant processing in a Cures Act compliant way to prevent any such fines from affecting your hospital. That's a hard thing to explain to the board of directors. Please reach out to us and we will explain more about this new software. Thanks for watching this video, and if you have any questions, please contact us. For the next month, you can contact our CEO directly. And we're offering reduced pricing for the next month while we fine-tune our sales system for this software for the benefit of our sales staff. And once that fine-tuning process is completed, the pricing will change.